Now you had this series of questions that I thought are very good questions.
Okay.
And many people have the same question. I'd like you to ask them, and then I like to answer them on the video.
Sure. I'd be glad to. Okay, I have 10 questions, and my number one, how careful do I have to be with the BLT?
Yeah.
2 to 4 months, 6 months, and a year. How careful?
Well, generally we say the BLT bending, twisting, lifting is something that put too much stress on the spine. Imagine your spine is like a crowbar. Your torso is the long arm of the crowbar, and the depth of your spine is the short of the arm of the crowbar. You can literally, with bending and twisting, put a metric or 2 metric ton of pressure on the screws.
Oh,
wow.
A screw that would take that kind of stress doesn't exist, and if it would exist, it wouldn't fit into your spine. So meaning that we tell you not to do those activities until we know the bone is growing. Those screws otherwise can get fatigued. You can pull them out, you can break them, and if you put under that kind of pressure, for that reason we say not to do those activities, and down the road we will get x-rays, CAT scan, and depending of your symptoms, we can slowly start doing more of those activities as well as lifting. Now, having said that,
yeah.
the bending, twisting, lifting is not good even for people who didn't have that kind of surgery. It just put too much stress on our spine. But the answer to your question is that at this time, we don't recommend it up to 6 months after the surgery. And after that, based on the imaging, we then loosen those restrictions.
Okay, fair enough. What I was going to say is this too much? Or is this too much? I mean, a person is, throughout the day, is going to move a little bit.
Those transitions going from one position to others are difficult. For that reason, we send people to physical therapy. They will exercise what is the right amount and what's the wrong amount. It is nothing that, I can just tell you based on you showing it to me, but we will send you to physical therapy and they will exercise with you what is the right amount.
Okay, very good. Okay, number 2, can the screws or rods be removed once the bones are completely fused?
We remove them only if they cause a problem, like if they get infected or if you fall down and break them or something like that. Otherwise, taking them out is yet another surgery that most of the time is not necessary.
Sure.
We use titanium screws. They usually, what we use is pure titanium. I have not even heard of that our body reject them or cause a problem. In the past, other screws like stainless steel or other impurities in the screws and so on would cause some problem, but I haven't even heard recently based on the kind of titanium we use that anybody has a problem with that, so we don't remove them usually.
Sure. Okay, fair enough. Okay, number 3, how long will the pain last from now until, say, 6 months?
Pain is a natural reaction of our body telling that whatever we are doing is too much. And in that sense, pain is just telling you what not to do. When along the time when the healing progress, you can do more before pain make you stop, but you have to always let pain stop you. And depending on your healing process, you can do more and the pain will get less. And that is individually different. Every person has a different kind of, pain threshold, healing process. Generally, we say up to a year until the bone grows back together, certain activity will cause pain. But vast majority of my patients after this kind of surgery, after a good part of the month, they are back to their basic daily activities with some pain with excessive activities.
Sure.
Okay, very good. Okay, well, how long do I need to use the bone growth stimulator and the back brace?
So the back brace, we say it's as a comfort measure for 4 weeks when you walk and for 4 months when you go in a car ride or anything that shakes your back. The bone growth stimulation, you don't feel, but it works on your spine by giving your cells in the bone some signal for them to grow faster. Usually we like you to wear it for the 9 months after the surgery. It has a device inside that turns itself off permanently once it's done. That takes about 9 months.
Okay.
Okay,
Yeah, now you don't even feel.
No,
Yeah.
I mean,
So it's just a little belt thing to wear.
it's just getting it put on in the morning
Yeah.
and getting going with it.
Mhm.
Okay, number 5, will I have trouble with adjacent discs and joints?
Yeah, no. What you have is what we call a degenerative spine syndrome. Degenerative is a medical term for us getting old, meaning that our body is like a mechanical device, like a car, and the discs are like a tire of a car. After certain amount of usage, they have wear and tears. For the levels that we did, once the bone grows back together, we are done. That is, when the bone once the bone grows together, those levels doesn't usually cause any problem anymore. But other levels are going to age at certain rate. And in medicine, what we do, we take care of a problem and then watch you. If there's other problem, we take care of it. And in most of the time, though, what we say, about 35% of the people who had the surgery in one level will end up with problem in other levels.
No.
But that has nothing to do with the surgery. If you have problem in one level, meaning that you have a car that has certain parts are failing, meaning that the other part of the car are as well aging at the same rate. So it just possibly the effect of aging process that other level will cause you as well a problem. Now the good news is most of the stress in the spine is in the lower level, meaning the upper level has less weight on it, less motion, and it fails much less. But generally we say about 35% of the people, with or without surgery, if you have a problem of the spine in one level, you will end up with problem of the spine in other levels.
Okay,
The
well,
alternative,
Well, one good thing, you've never had any upper level
excellent.
problems, so that's
Problem
good.
in the upper level in the chest are much more rare because the rib cage is like
Sure.
internal brace supporting that.
oh, sure. Okay, number 6, my back had a twist in it and made it difficult for you in surgery. Can you tell me a little bit
Yeah.
about that?
We demonstrated on that. Look at that. If I'm going to your back had a scoliosis, but additionally your back had a twist. And here I cannot even do the twist without breaking my model, and I did that. So
Mhm.
here your back was twisting like that, and that makes this kind of surgery technically more difficult. But in an inspired spine, we have our this technologically advanced method and instrument to get the job done.
Wow.
And by looking at that, most of the twist is corrected, most of the scoliosis is corrected. So we got the job done.
Mhm.
Very good. Okay, let's see, now number 7. I counted about 10 or 11 incisions on my back. Can you talk a little bit about those incisions?
Absolutely. Now, for people who don't understand much about minimal invasive, many of my colleagues, they think it's about size of the incision that makes this what we did minimal invasive. Whereas in the open surgery, we fillet you open. Here, we make incision and place those individual hardware and build the construct inside little by little. We usually use 1 or 2 incision to put the cages in these 3 places. Then each of the screws need its own small little half-inch incision to put the screw in. The bottom 2 screws usually use the same kind of hole to get in. And then we use another incision to put that rod in place here. So literally we make lots of little incision and build the construct inside of you without really disturbing the muscle and cutting the muscle and cutting the bone. And those little incisions, they heal much better than one big incision. The fact that we don't strip the muscle of the bone, we don't take the blood supply of the bone away, make the bone heal much faster. We just did a study. We have a rate of fusion that is unheard of in open surgery, as well as by keeping the muscle alive, that helps you recover much faster. Now, those little incisions as well are separated, meaning if one of them get infected, the others don't get infected.
Oh, yeah.
So the risk of infection is much lower. But at the end of the day, let's put it the number. I think the statistic is important. Whereas in the open surgery, there is 3 to 5% of risk of infection. Our risk of infection is 0.3, meaning that from 800 patients that we have done surgery, only 2 of them got a little bit of infection on the skin,
Sure.
but they didn't even require any kind of opening or drainage or anything like that. We just give them antibiotic, and both people had extraordinary circumstances. So even though we have lots of skin incision, there are huge advantage of what we are doing by not disturbing the muscle, not killing the muscle, not denervating the muscle, and not taking the vascular supply of the muscle and bone away. And people heal much faster, as you are an example of that. You're just 1 month after a severe scoliosis. Usually after open surgery, this kind of result are expected within at least 3 to 6 months.
Gee,
Yeah.
that's
Yeah.
something.
Yeah.
You know, other than bruising on his back, he had pretty good bruising. Those
Mhm.
incisions look great.
Yeah.
They didn't, I mean,
And
they
that is,
healed
I think,
so
is
nicely.
important information
Yeah.
as well.
Yeah.
Because we don't put a drain, if there's some bleeding under the skin, that's what the bruising is.
Yeah.
Sometimes they can even sag down. They are at first blue, and then they turn sometimes
Yeah.
even black, and then after usually 2 to 4 weeks they go away.
Yeah, and it was more dependent. you know,
Yes,
just
yes.
down to the
That
lower
you
back.
just described
Yep,
it,
yep.
and that's good to have it as well for
Yeah.
people to expect it.
It looked really good.
Okay, so let's see. Oh yeah, the simple one, how much walking should I be doing
Mhm.
right now?
Frequent small walks are good. Anything excessive is bad, and your pain level should guide you. If you have a pain, just don't see what you did in that moment, but see what you did that day or the day before or 2 days before. People are telling me the pain is cyclical, meaning that you have good days, you do more, the pain gets worse based on
Mhm.
doing a little more activity than your spine can take. Pain make you stop doing things. Your back get a rest, get better. So getting up and down is nothing unusual, and usually people notice it's up and down, but generally they get better and better.
Mhm.
Yeah,
Mhm.
okay, good, all right. Number 9, what is direct decompression and will I need it?
Fantastic question.
Mhm.
So in a regular surgery, what my colleague called direct decompression is we cut literally absolutely back of the bone to give the spinal canal more space. Literally we destabilize it. Nature, God, evolution, whatever you call it, put that there for a reason. And for us to give spine more space and open up this hole, my colleagues and in many open cases, we cut this part, we call it laminectomy, we cut this part, we call it facetectomy, to open up this part where the nerves are going through.
Ah.
Whereas in the nature, the way that hole is open is by this disc keeping that hole open.
Sure.
We restore that disc to how nature meant to be by doing this. We call it anatomical physiological decompression. In vast majority of our patient wake up and the leg pain is gone. But
Yeah.
in some cases, rare cases, we need to supplement with going back there and opening up that hole. That risk is very low, but obviously some people they still need some kind of opening of that hole, literally by biting on the bone.
Mhm.
But in vast majority of the cases, what we do is more than enough, and it seems in your case it has been enough.
Yeah, sure seems good
Mhm.
now. Okay, let's see, number 10, my last question. You said symptoms are livable before surgery, and I guess that was a typo
Yeah,
in the summary. And then
It's about the indication of the surgery. You know, obviously there's no question you have a bad back, but we have put these protocols in place that we do the surgery. From 100 people get to us, only a small fraction get the surgery because we are able to make their symptoms livable. And our
Yeah.
take on that is, if the symptoms are livable, you shouldn't get.
Don't go for
Surgery.
yeah.
And I think what we generally do, we try to make you feel better with physical therapy, with injections, with bracing and so on. If all of that fails, then we provide the surgery. This surgery took us, I think I can look it up in my record. It took us somewhere around 2 hours, if I'm not mistaken.
Yeah, you told me 2.5 hours.
Yeah,
you were
and
able
it is
to
a very
complete it.
complex surgery. And it took us
Yeah.
146 minutes, which is 1 hour and 26 minutes.
Oh my goodness.
And this, in the open old-fashioned surgery, this is easily 7-8 hour
Oh, yeah.
surgery. And,
Mhm.
wow,
so if, first of all, if other means can make you comfortable, you shouldn't get the surgery.
Mhm.
If other means fail, this kind of minimally invasive can put you on a path to get better, much faster, much safer by any categories that we have looked at. As a matter of fact, we are publishing our data, and it'll be available. It's medical mumbo jumbo, but still, you know, there are information out there for everybody to look at them.
Sure. So my last follow-up question is, did I make the right decision for me?
Well,
Did you?
that is a question for you. Comparing to how you were before and how you are just 1 month after the surgery, did you?
Well, I think I made the right decision, but I wanted to hear you say that yes, you needed this, it was the right decision.
Yeah, well, you know, it wasn't ever a question that you needed the surgery because your spine was twisting and you didn't have the basic quality of life,
No,
as she
not
just
at
said.
all. No.
And it seems that we are 1 month after the surgery. I just needed to put it in perspective. 1 month after the surgery, after open surgery, you still would be miserable.
Sure,
And-
sure.
but 1 month after the surgery is not in our medical field where we make a decision, was it worth it or not? Because you may feel in horrible pain 2 weeks after the surgery, and you told me that for 2 weeks he was in pain, and then it was like a
Yeah,
switch.
it was just almost like, the gals here kept saying about 2 weeks, and after that it just started getting better. And I'm not kidding you, about the 2-week timeline, things started feeling a little bit better for Mark, and
Yeah.
you're up and about a little bit, that you're able to tolerate, you know, the usage of his pain meds a little bit better and whatnot. But
And
you know, and he did, getting back to, you know, the surgery, do I need it or not? He did try every single thing in the book. I mean, it went from PT to several back
Yeah.
injections, and you did needling of the nerves or whatever they call it, and all that kind of stuff.
Right.
And
we are just 4 weeks after the surgery. I think, you know, I think your disadvantage is you haven't seen the alternatives, and I
no,
have.
yes,
Sure.
I
right.
think you're way ahead of the curve,
Mhm.
and you have a long way to go, and it's going to get better and better. In medicine, when we answer the question, was it worth it or not, is a 1 year after the surgery.
Okay.
We just got our data to publish that. The results are impressive. The amount of the improvement people get comparing to whatever is out there is impressive. So there wasn't you have a scoliosis, you have a severe disc disease, nerves were under pressure. On the medical side, it wasn't even a question. But on the personal side, it's always a different
Yeah.
story. And the true answer to that, was it worth it or not, is the question that only you can answer.
Yeah. Well, I feel like so far so good.
Yeah. We noticed that the leg pain, you have no leg pain, and you noticed that your pain, which was 7 and 8, is now 4, around
Yeah.
4.
Yeah.
So, and this is just 1 month after the surgery. I think I'm pretty happy with the results so far.
Okay.
Any other question or comment?
No, I don't think so.
Thank you very much for the
Yes, thank
interview.
you,
Thank you.
Dr.
Thank you.
Allison.